If you've got a lump, sore, colored patch, or itch around the vagina that won't leave, this video about what to look for is your checklist. Hey, I'm Dr. Sylvia, NHS GP and women's health doctor. I'm here with Dr. Tolu, a gynecologist and vulval disease specialist, holding the Vulval Table Conversations.
For many years, the need for a regular structured vulva examination has been lost, not just on the public, but also lost even to healthcare professionals. And you're right, we examine her breast. You would advise a woman to examine her breast at least once a month and check for lumps and bumps. Why can't we do the same with a vulva? Because once you know what a normal is, you can easily flag up an abnormal, no matter how tiny or no matter how early in the disease system or ecosystem you pick it up. So how often should you check your vulva? Personally, I would say every month. Some other authorities would advise at least every 3 months. So at least 4 times a year, you have had a structured, detailed examination of the vulva. People tend to think because they shave, or they tend to think because they have a daily wash, that equates or that serves as a vulva examination. I'm so sorry to say this, it does not. Because a vulva examination requires an inspection where you actually have a good look in a structured format and a palpation where you actually have a good feel. When you shave, you might be lucky if you have a Sahel or a Sahara looking vulva to be able to see any such of features. But if you have a good rainforest, chances are, if you're not very structured in your approach, any small changes, guess what, will be lost to observation. That is one. Then, apart from the inspection, we talk of the palpation. So with the palpation, we talk of the lumps, bumps, and ulcers. So just like you do with the breast, where you feel for lumps and bumps, likewise with the vulva, the lumps and bumps, you pick up things like the bafflings, you pick up things like the inclusion cyst, you pick up things like the warts, so to speak. And the ulcers particularly feature more with things like your dermatosis, such as your lichen sclerosis in the much older woman. But more importantly for me is vulval cancers. So with vulval cancers, it is rather rare, but it is preventable. So why aren't we preventing the few cases we get if we have a structured vulva examination going on board, whereby we can flag up the ones that need specialist input, the ones that need specialist advice and treatment in a timely fashion. So I'll go back again. Structured vulva examination. Let's imagine this is the vulva. Imagine it's the face of a clock and divide it into 4 quarters. What you need to do is you need to look from the inner bit on the way to the outside. So we're looking at the vestibule, yes, and making our way out 4 times. So each quarter, the first quarter, the second quarter, the third quarter, and then the fourth quarter. And you do that looking for changes in skin color. You do that looking for changes in lumps and bumps. You do that looking for even texture. Sometimes it's even the texture. The skin just feels a bit frazzled, like dry paper, like parchment paper. When it comes to what is an abnormal vulva, that's a big question. What I normally tend to say is, has there been a change in color? It might be a tiny change, it might be a big change, because we do know vulvar melanomas, though infrequent or relatively infrequent, can still occur. We catch them early, guess what? They do better.
Or what is it that I want my patient to do? And the reason I ask is because when we tell women about examining our breast, we say to them, I'm not expecting you to go digging looking for a lump. Examine your breast and get to know what your breasts feel like. So we tell her to get into a nice comfortable position, get a mirror, nicely lit room, or some that want to stand in the bath, get a mirror, maybe those small compact mirrors. What should she look for?
For somebody who's not medically inclined, I'll say lumps and bumps will be the first thing for the younger woman, because that seems to be the more common presentation. With the discharge, you're talking about maybe an infection. So for the younger woman, lumps, bumps, abnormal looking discharge. So she gets discharge, or she gets this itch, or she gets this irritation down below. The skin looks a bit red. So then she's thinking, what's going on here? Particularly, she's just changed partners. So she's got to think in that sort of direction. For the older woman, I would say lumps, bumps, and ulcers, because you've got to think about dermatosis. And for those, for instance, who also have your gynecology problems, you get this chemical vulvitis, rapid inflammation of the area. I would also talk about discharge too, because for those who have poorly controlled diabetes, they often end up with vulvovaginal candidiasis as well. The discharge is important. Vulval conditions outside of infection and inflammation are slowly undulating disease states. They just don't start suddenly outside of maybe allergy.
Yeah.
So outside of inflammation, infection, and allergies, they grow slowly over a period of time. Be comfortable with what your vulva feels is also important.
If there was just one symptom that, if it was picked up and acted on at the early stage, you would just want a woman who's watched this to be aware of. You don't want her to miss.
The one symptom I would say is, number one, any persistent vulvar irritation. Now, that vulvar irritation could be stinging or burning sensation. It could be a itch that just never goes away and drives you putty. Or it could just be that pain that is a dull ache and you just can't get rid of it. You have those conditions, or you have any of those conditions, please, and it's persistent, certainly over 2 weeks. It's not resolved with any sort of intervention, usually over-the-counter interventions. You need to come and see us, because sometimes with vulval cancers, particularly if it's HPV related, you may not necessarily get a big lesion to the untrained eye, and you might need to undergo further endoscopies. And the only thing that would make you, that gives you the cute calling card, as it were, into the gynecologist office is that, you know what, there's this stinging, there's this discomfort, I can't get rid of it, I've tried everything, it's not going away. And even to the naked eye, we're thinking, there's something here, but we're not entirely sure, until we then carry on for the test. And we might say, okay, this might be HPV related vulvar intraepithelial neoplasia that needs to be acted upon, or this might be maybe early onset lichen sclerosis, or even lichen sclerosis that's been going on for a while, but she just never realized that this was not normal skin, and that is now accelerated in its evolution picture. I would say discomfort, pain, stinging, scratch, just name it, discomfort that is not settling after 2 weeks. You need to come and see us so you can have a look, please.
Okay, lovely. Thank you so much. We've been listening to a conversation with a vulval specialist, and we've been looking at different issues around vulva and vagina. The purpose of this is to make this conversation comfortable for women, make it easy for us to be able to talk about our vulva as any other part of our body, so that if something goes wrong, we're not shy or embarrassed about talking to them. That is what this series, the Vulval Table from Symptoms to Solution, is all about.
So, what to look for? Check with the mirror, have a look and feel. Warning signs to watch for: new lumps, color or change in texture or feel, a discharge, ulcers, and any irritation that lasts more than 2 weeks. Next, we're going into specific conditions. Subscribe and drop your questions below.